What I want to talk to you about today is new avenues for treating pain. Opioids are a huge problem right now in the United States, where approximately 80 people are actually dying every single day from opioid-related drug overdoses. Opioids aren't very effective, so often you'll give them to a patient and they'll still be experiencing pain. They're also extremely addictive, as we know. But the problem is that despite knowing all of these concerns about their safety, it still is really our first and only line of treatment for the approximately 1/3 of people in this country that suffer from chronic pain. So just to think about this is more than suffer from cancer, heart disease, and diabetes combined. That's how many people are suffering from chronic pain. So I think these numbers alone demonstrate we have a real desperate need to find new pain relief medicines. So this is the motivation for the work that I'm doing during my postdoc. So what I am doing is trying to understand how we communicate with the things going on in our environment. How do we sense, detect, and respond to changes? And primarily, I'm looking at changes in temperature. We really have very little idea of the details of what happens when we experience a change in temperature in our environment. So we do know that temperature is detected by our sensory system, and we also know that pain is detected by our sensory system. Furthermore, we know that there's a group of proteins in our body known as TRP channels, and the TRP in TRP channel stands for transient receptor potential. Now, these TRP channels are what I study. They sit in the barrier that surrounds our cells, and when we encounter a stimuli outside, they'll actually open. And this creates an opening where the information can come from the outside of our cell to the inside of our cell, and then eventually this information will be passed on to our brain and will respond appropriately. In my working group, we discovered 2 TRP channels that are actually temperature sensors. They're called TRPV1 and TRPM8. And very interestingly, we discovered that TRPV1 is what's responsible for responding to hot temperatures and capsaicin. Now, capsaicin, as some of you might know, is the active ingredient in peppers, and this is why when we have peppers, we may have that hot or spicy feeling. In the converse, TRPM8 is responsible for our detection of cold temperatures, and then also menthol. Now, menthol is the active compound in mint, which explains why when you're chewing that peppermint gum or you have that mouthwash, you may feel that kind of cooling sensation. Now, we know there's this problem with chronic pain. We know there's also this link between pain and temperature sensing. Now, a little bit more information about why I really think there's a link between the two and why targeting our temperature sensors might be a good idea to target chronic pain and alleviate this pain in so many patients. So to think about this, let's discuss a little more the cold receptor, TRPM8. So there's 2 very interesting things we know about TRPM8, which are linked directly to pain. So the first is that some people experience something called cold hypersensitivity, which is also known as cold allodynia. In the clinic, what this is a patient presents with experiencing extreme debilitating pain, and this is in response to a stimuli that normally wouldn't cause us pain, like, let's say, eating a cold ice cream. So this can be caused by a variety of things. It can be caused by physical nerve damage. It can also be a side effect of the chemotherapy treatments that we give cancer patients. But most importantly, what we know is that if we stop TRPM8 from working and it can't detect that cold, that person wouldn't feel that pain. Then there's the whole flip side of the story, which is that we've known for many, many years, and I'm sure we're all very familiar with this. You're out on the basketball court, you fall, you sprain your ankle. Now you have the sports-related injury, and what's the first thing we do? We use cold temperatures, either in the form of an ice pack, or we can even buy in the drugstore those sports rubs. Actually, those are full of menthol, also giving you that cooling effect and cooling you down. So what we're experiencing here is that we're able to treat sports injuries and this type of pain by actually having TRPM8 work harder. So we know that getting TRPM8 to work more can relieve sports-related pain, and the real question is, can we leverage this to treat a much wider breadth of pain disorders? So now we've established there's a problem. We've got an idea for a solution. Might want to make a drug that could either cause this protein TRPM8 to work more, or let's say work less, depending on if it's cold hypersensitivity or depending on if it's a more broader type of pain. So what do we do? So actually the truth is, to develop a drug that specifically targets something, we need to understand in incredible detail how it works. Because once you understand how it works and you really see how it works, that's how you can put the wrench in it to get it to stop working. So what I am doing, using pioneering work that's going on at UCSF, I'm actually visualizing these temperature sensors, looking at them in action as they work. So these things are too small to see with a microscope, but using the powerful techniques that we now have, we can actually capture what the protein looks like, then we can expose it to, let's say, a cold temperature, and then we can see what changes infer. So this is the work that I'm doing, and I'm hoping that it will lay the groundwork and the foundation and the first steps for opening up new ideas for a new class of pain drugs. You could imagine targeting these TRP channels and actually others, of which there are almost 30, so that we can reduce our dependency on opioids and give all of these many people suffering from chronic pain just a new pain treatment option. Thank you very much.